Hello, I'm Dr. Farrell Tyson. I'm a cataract refractive surgeon in Cape Coral, Fort Myers, Florida. I've been using the NIDEK AL-Scan for several years now. One of the reasons that we purchased it for our practice was that we found that it was highly efficient. It also is highly effective in our practice. One of the things that we noticed was that we were able to utilize this device with just about all of our tech team. We didn't have to have a specialized biometry tech. And so this made a big difference. But the other thing that we noticed is in the past, we'd used the IOL Master 500 and the LensStar, and there was a big difference in the amount of time that it was taking to actually perform the exam. And so this made it a lot easier on our staff. We were able to better utilize them, but also it was easier on the patients. So what we found is with the LensStar, it was taking about over 3 minutes to acquire the data. The IOL Master 500, it was about 3 times slower than the AL scan. So for my AL scan patients, it was about 30 seconds. So when it came time to buy another device for our satellite offices, my techs actually came to me and asked me to go ahead and get another AL scan, that they preferred it over the competing devices that we had in the practice. The other nice thing about this is the integration that's there. We love our NIDEK OPD3, and it's easily integrated in with the AL scan, so I have a biometry suite. This allowed us to do autorefraction, keratometry, our corneal topography, and have that all integrated and verified by the AL scan. And if you want an endothelial cell counter, their endothelial cell counter would also integrate well. So a lot of people are talking about, well, what do we need? What's important with this? Is it the axial length, the keratometry? Well, all the devices on the market do a very good job of getting the axial length, but they do it in different methods. The IOL Master and the LensStar, they take a series of readings and then average it. Well, that's theoretically sounds very good because you're going to hopefully average out the noise. But the AL scan actually looks at the different axial length measurements and picks the one with the highest signal to noise ratio. So it's picking the most accurate one instead of trying to average a bunch of readings and hopefully average out the bad readings. So this approach makes more sense to me, especially seeing that I was an engineer first. And one of the things that you hear, kind of like a myth that's out there, is that there is an axial length, A constant for optical biometry and one for ultrasound biometry. And really, it's kind of a spoof because all the devices do a very good job of getting the axial length. It's the keratometry in the formula that changes. And so what we've looked at in several studies was how well do these axial lengths correlate? And in the Journal of Ophthalmology, they did a very nice study on the AL scan versus the IOL Master. And what they found was that the axial length measurements correlated statistically to be similar. So we know that we're getting very accurate and reproducible axial length measurements. The question is, what about the keratometry? In the original IOL Master, they used 6 points. That's great, because all they were looking for was average Ks. And this is what we need to understand. Back in the old days, all we cared about was taking the cataract out, putting the lens in, and being relatively close for our distance refraction for sphere. We weren't that worried about toric IOLs at that time. Later, we started seeing the advent of premium lenses, and now the astigmatism really matters, not just the average for the IOL formulas, but also for knowing what the axis and the magnitude is for your toric IOL placements. And so if you notice, as the different devices have developed, we've added more and more points. With the AL scan, we're actually looking at 2 different rings, and the user has the choice of picking which rings they want to use. Do they want the one at 2.4 millimeters, so 360 points there, or 360 points at 3.3 millimeters? So what I do like about this device is I'm able to choose which type of readings I want to use. I can choose which type of formulas, and we're going to get into some of those other options. But with this many points, we are getting very good keratometry, not just for the average for the formulas, but also for the axis and the magnitude when it comes to picking your toric IOL. When looking at IOL calculations, we've all grown up with a lot of different formulas out there. This device has the ones that we're all familiar with. But what I always wondered was, why can't I pick which formulas for which type of eyes? Because we've always known that your 3rd generation formulas, some were good for long eyes, some were good for short eyes, and some were good for the medium-sized eyes. Well, if you want to, you can set up the device to be able to automatically select which lens formula you want to use based off the axial length. That's one option. The other thing is you can have different lens formulas for different lenses. So it's highly customizable to how you want to see things. And so for me, I prefer to have my formulas being auto-selected by axial length. And you also have the ability to have some of the newer fourth generation formulas like the Barrett available to you. So this gives you the functionality, but it also gives you the precision that you're looking for. So in conclusion, what I found is that this device really helped me in my practice from a workflow standpoint. It helped me with my accuracy in being able to obtain the data that I needed to have the outcomes that are necessary, especially with premium IOLs. But it's also that ease of use. And so when you have a practice, you want to have the latest and greatest, but you also want something that is actually functionable in your clinic. And so this is very easy for my technicians. It's very point and shoot, but also the results that I get have been phenomenal, and I hit my targets, and that means I have happy patients. With happy patients, they repeat customers because they tell their friends, and that helps grow your practice. So thank you very much.